Hi, Kate Collins, staff scientist here at TELUS World of Science Edmonton. We are joined today by Dr. Maulik Baxi, resident in public health and preventative medicine at the University of Alberta. Welcome. Thank you so much for joining us today.
Thank you so much, Kate.
So let's start off by hearing a little bit about your role during the pandemic. What have you been working on?
Okay. So as resident in public health and preventive medicine, there are different types of things that we do. And in the last few months, we have been involved in preparation, myself including, and my other colleague residents as well, in preparing the public health system and understanding the nuances of the disease itself, the transmission, the risks, the spread, and the approaches to care of people who have been affected by the pandemic. More recently, I've been involved with working on contact tracing for patients who have had confirmed cases of COVID and patients who are, or individuals who are exposed to the cases of COVID.
Wonderful. So let's back up a little bit. What is contact tracing and why is it important?
So that's a great question. So in a nutshell, contact tracing is the process of systematically identifying, notifying, educating, and managing the cases of coronavirus, as well as individuals who are in contact with those cases. And by managing, I mean we educate them, we notify them, we tell them that either you have the disease or you're exposed to someone who has the disease. Then we educate them about the virus, about the risks, about the process for isolation or self-isolation that they need to go through, as well as what to do in case they feel sicker. And finally, at what point we would consider them recovered, what are the procedures around that, what are the precautions that they need to take. And then in the process, if we come across any red flags, anything that needs further public health follow-up or actions, such as workplace exposure, exposure to healthcare workers, exposure to somebody who is sick or who are at higher risk of complications, then taking appropriate preventive actions for those individuals.
Interesting. So if I was to get diagnosed with COVID-19, I'm just wondering what would that process look like for me and the people that I've been in contact with from a contact tracing perspective?
Okay. So COVID-19, as you know, is a respiratory illness primarily. And so most people would start feeling some symptoms, including fever, runny nose, cough, chest pain. And with some of those symptoms or a combination of those symptoms, what we ask them is they take the online testing that is online questionnaire that has been developed and is available on the Alberta Health Services website. Based on the testing, you will get a call from public health for testing, and public health will then arrange testing at a drive-through location. If somebody who is sicker, then we ask that they contact 911 instead, and the 911 will then arrange for subsequent testing, transportation if needed to a hospital facility. Based on the testing results, which usually are available within 24 to 48 hours at this point, however, it keeps changing and depending upon how many cases we test and where the patient lives. Based on the testing results, if the person is positive, we ask them to further isolate at that point for a period of at least 10 days and 14 days if they're healthcare workers. And then going forward, monitor themselves for any symptoms, any progression, any worsening. At the same time, we ask them to isolate from their family members as much as possible. And I know that is not easy, but it is important for protection of your loved ones as well. So those are some of the early steps that we take. So those are parts of the process where contact tracers get involved as well. And for individuals who remain symptomatic afterwards, then we ask them to stay isolated till the symptoms resolve. If the symptoms have resolved by the day 10, then they're good to go and we consider them recovered.
Interesting. So tell me, who is doing the contact tracing here in Edmonton?
Okay, so contact tracing is like I mentioned, a public health activity primarily. And so our largest contingent of contact tracing is actually our communicable diseases nurses. And under that umbrella, the communicable disease nurses, because of the case volume, also are receiving support from medical students from the University of Alberta School of Medicine, as well as in Calgary, our counterparts are doing same things from the U of C. The medical students and the nurses do the contact tracing when they receive information from the lab of a confirmed case. They call the patient, identify all their family members that were exposed to them, if there were any workplace contacts, if there were any other contacts, and then they would take up the action of following up with those contacts as well to make sure that the contacts themselves remain symptom-free. If the contacts themselves are symptomatic, so if they have any of the cough, fever, the other things that I mentioned, then we also arrange for their testing as well. So we are testing not just the case, but also the contacts of the case who meet the definition and criteria for testing.
Wow, that sounds like a big process and a big job. So from what I understand, contact tracing is not new, though. This is something that has helped us control other outbreaks in the past. Are there any other outbreaks that it has been really useful to use contact tracing for?
That is a great question. Like I mentioned, contact tracing is one of the cornerstones of public health intervention for communicable diseases control. So it has been used for decades in the past. And I mean, there are a number of situations and all notifiable diseases, for example, any disease where you see a human-to-human transmission. So for example, you have tuberculosis, you have sexually transmitted infections, you have meningitis, you have a lot of vaccine preventable diseases like measles, diphtheria, pertussis. A lot of those diseases would require some sort of contact tracing and then subsequent public health actions. And depending upon whether the disease had any outbreak clusters associated with it, or it was an isolated case, we still contact trace all of those patients and their contacts.
Wow, so it's really widely used for many, many different communicable diseases. So that's very
Correct.
interesting. So from what I understand, the Government of Alberta has released an app which Albertans can download to help speed up contact tracing. Would you be able to tell us a little bit about how this app will work and how the team here in Edmonton might use it to be able to help with contact tracing?
For sure. Like you mentioned, it's a Government of Alberta app. So with Alberta Health Services, we are working closely with the government to provide them the information and exchange the information with the government to help develop and adjust the app as the pandemic progresses. The app's intention is to complement the process of contact tracing. So it doesn't really substitute the contact tracing. The app doesn't contact trace a patient for us. We can, and at some point we will start using the information that we will receive from the Government of Alberta that has been collected via the app. Usually the purpose of the app is to identify the locations where the patient was while they were infectious to other people, and then identify individuals who may have been exposed to this patient. So in some shape or form, a lot of these apps, probably including the Government of Alberta apps, also uses the geolocation of the patient and then identifies the location. Based on the location, we can work with the patient to figure out who was actually exposed to them.
Wonderful. I downloaded the app, so I'm interested to see how it will be useful for helping contain the spread of COVID-19. Well, thank you so much for joining us today, Dr. Baxi. That was really, really interesting to hear more about contact tracing and what is happening here in Edmonton.
Thank you so much for having me. It was great talking with you, and hopefully this will be useful for all Albertans and everybody who listens to this.
Wonderful. Have a great rest of your afternoon.
You as well. Thank you.